This video will cover Chapter 12, Developmental Psychology for PSY 120, Careers in Psychology, Neuroscience, and Human Development. Developmental psychology is primarily a research-based discipline. It's the study of how people grow, develop, and change. Originally, if you look back historically, developmental psychology tended to emphasize childhood. But as the field has grown and expanded, the whole lifespan is considered to be important. Historically, it was assumed that, people grow up and then change basically stops. That outdated assumption has been tossed out. People continue to grow and change across the lifespan. Developmental psychologists study all aspects of human experience, emotion, cognition, behavior. They are typically found to specialize in specific parts of the lifespan. Some people are lifespan developmentalists. They study the entire lifespan, but a lot of developmental psychologists are going to pick a time period. So studying kids or even infants and toddlers, adolescents, adults, older adults, for example. Within the field of developmental psychology, one of the areas that's growing very quickly is the study of gerontology. We are an aging culture. People are living longer and they're living more complex lives as they age. As a result, there has been, I would say over the past 20 years or so, a steady kind of increase in interest in old age and how people continue to age from middle age through their later adult years. Applied developmental psychology is a specialization where you can have developmental scientists who study practical problems. On occasion, and we'll talk about this later in the chapter, these are individuals who do service provision, but they have to do so under very specific circumstances. So if you have an interest in development, in developmental psychology, what kind of bachelor's jobs may be attractive to you? There are service coordinators or care managers who work in gerontology. We have a lot of older adults who require assisted living, who require memory care, who require supervision. There's also people who are older and they want to live in community with other older people. So there are a lot of opportunities emerging for gerontology services. Service coordinators or geriatric care managers work with older adults and their families, making sure that they get the services that they need. They also may be engaged in developing programs for older adults. In some cases, these are health promotion programs, but they can also just be activities-based programs, getting people engaged in intergenerational activities, connecting them up with community agencies, getting them connected with exercise programs, and so on. Such coordinators may also work in group homes or other kinds of group living contexts. They will do oversight over aides, gerontology aides, and human service workers who are more likely to be doing direct care provision. So the management side, you may have, a whole cadre of people underneath you whose responsibility it is to have one-on-one contact with clients. Typically, these coordinators or managers have a bachelor's degree in areas like psych or social work or nursing. They may have gerontology coursework in their background. This is one of those areas where our human development and family sciences majors, they may have an affinity for this kind of work. Another place where our HDFS majors may find a home is as a child life specialist. Child life specialists are people who work in hospital settings or in other medical settings to help kids and their families better understand what's going on with them. So, for example, if you have a child that's diagnosed with cancer and they're going to be undergoing repeated medical procedures, the child life specialist's job is to help communicate to that child in an age-appropriate way what they're likely to experience, to ease that process, and also to talk with the family to help them understand what's going on so that they're less anxious undergoing medical experiences. So they're going to work collaboratively with the healthcare team, with medical professionals, to help people navigate our very complex medical system at a time when, they're probably pretty stressed and anxious. An understanding of developmental psychology is really important here because child life specialists need to be able to come up with age-appropriate strategies that minimize trauma and help people to more successfully navigate their way through illness and injury. So their role is primarily educational. So they instruct kids and families about what they're going to experience, but they also have a support role, giving emotional support for parents, for kids as they are navigating hospitalization. Becoming a child life specialist does require certification at the present time. So what is required typically, and it's varies state to state a little bit, you have to have coursework that is relevant. So most certification programs are going to ask for evidence of the study of family systems, of things like death and dying, which are, our HDFS students, our Human Development and Family Science students, in their program, they're going to encounter those kinds of courses. And then certification requires a 600-hour internship experience under supervision and the completion of a certification exam. There's also opportunities in student and residential services at colleges and universities, but also private high schools as well. So you have people who perform the role of director of student services, maybe student activities director. They're going to be tasked with the job of building extracurricular programs for colleges and universities. The director is going to identify and put into place strategies for increasing student use of services and getting them engaged with programs that are offered by the university. Bachelor's degree holders who may have less experience may be hired as assistants to directors or as lower level positions that have too many different variable names for me to list here. Resident directors are staff members on a college campus who supervise residence halls or dorms. Now, in most cases, RDs are hired from the outside, and they work for the university to oversee students who are resident assistants. Now, these titles are different depending on the institution. There are a variety of norms that shift in terms of how these people are named. But I'm sure you're familiar as a college student with who these people are in your environment. There are also more broadly defined program coordinators, and these are people who work in a variety of different settings. They may be in a social service agency of some kind, for example, or in a youth outreach agency. Coordinators are going to be responsible for the day-to-day running of such programs. They will assist directors, so they're decision makers above the program coordinator who are responsible for communicating the mission and the goals of the organization. The program coordinator is going to put them into play. They oversee the day-to-day operations. They coordinate activities, events. They schedule things, make sure things run on that schedule. If you have an organization that's really big and has multiple programs that need to be coordinated, program coordinators may have a group of program assistants who work with the program coordinator to make sure that all of their tasks get done. Many times, big organizations that deliver social services, they need data. So the assistants may be tasked with entering data, analyzing data, producing reports, and providing those reports to the people above them. I have one student right now who graduated a couple of years ago who works with a nonprofit, and essentially, I don't think it says this on her resume, but essentially she's doing program coordination. So she responds to her, the CEO of the organization and other upper tier individuals like the members of the board for this relatively small organization. And she coordinates the activities. She keeps the calendar. She accesses the data that comes from the fundraising side, that comes from the contact side. She's also involved in some fundraising, some budgeting, marketing, community outreach. So really pivotal position, and it is bachelor's level. What kind of preparation in terms of psychology coursework is relevant here? And I would add here, since this is a chapter that really kind of gravitates toward our human development and family sciences students, anything related to development. So lifespan development courses, family studies or family systems courses, early childhood courses, child psychopathology, adolescent psych, adulthood and aging, all of those courses matter. And then you can kind of add in some of the sociology courses as well. Those aren't listed here in your chapter, but there are classes on the family, there are classes on family systems, and so on that can be really, really helpful going into careers straight out of college. In terms of elective coursework, communication, since so many of these types of positions involve some aspect of management, accounting and business administration can be helpful. But also, writing and social work are obvious connections. In terms of applied experiences, so what kind of internship experiences may prepare you? Working in clubs with kids can be a good starting point. If you're interested in child life specialist positions, do some volunteering in hospitals because the environment is its own special kind of place. And, going into it blind is a bad idea. So I would recommend getting some firsthand experience. Working in daycares, working in geriatric facilities, working in organizations that serve the needs of people with developmental disabilities, and a variety of other nonprofits. Some research experiences that can be great is seeking out faculty who do developmental research. Or if you're looking at sociology, look for, those faculty members who are doing research that look specifically at age-related variables. I would also put a plug in for public health type courses, because that's a nice set of intersections that are related to the work connected to developmental psychology. And that concludes part 1 of chapter 12.